Welcome back. I'm Dr. Elisa Hernandez, and this is your health radio and television program. And today we are speaking about positive behavioral interventions and supports. PBIS is the short name for that program. We are now going to be speaking with Dr. Sid Smith, and he is the Deputy Director of Monterey County Behavioral Health, the Children's Health Division. And he is here to join in the conversation about PBIS and tell us a little bit more about Monterey County's role, specifically Monterey County Behavioral Health's role in the program and why this program is important for the county. Thank you, Dr. Smith.
You're very welcome. We feel this is a program is a very good fit for Monterey County. In addition to the research they do about how effective the program is, this is a group that also researches how do we know if a school is ready to bring in this model. So it's not just by chance. They need to have, they can assess if the leadership is in place at the school site and if the leadership at the administrative level is in support of the program to sustain it. It's more than just a 1 year, let's bring this model in. It really does need to be nurtured and grown over the years so it's completely embedded in the culture of the school. And so by assessing if the staff are ready for this model and administrative support it, that gives you a real good indication that it's a good time to bring in that model. And by the response we got when we put this offer out to the various schools, very enthusiastic responses from the schools and the administrators. And administrative staff are involved in all of the training, so they're fully involved in what it's about and what it takes to support it on an ongoing basis.
So you need a lot of stakeholders involved.
Absolutely.
At all levels.
And the timing is right in other ways in that there are a number of efforts in our community to address a number of issues, whether it's gang violence or whatever. The efforts we have here are supportive of that. The more we keep kids in school and being successful, we're helping their development, but we're also avoiding other problems that come up. Just this morning, driving to work, I heard a radio program on the efforts going on in San Jose to reduce gang violence. And one program they're bringing in is how to identify the educational needs of students that they have identified at risk of gang involvement, because they know if they can identify those academic areas that they can help these kids in and engage them in learning and having that be successful. If you keep them in school, you're keeping them out of gangs, and they go from being at risk of getting in gangs to being involved in a very positive activity. So the timing just seemed perfect for it, in addition to having an expert in our backyard with Dr. Hauer being here in the community to lead the training in this model. So
did you, behavioral health, make that assessment to see if the schools were ready? It was a self-assessment.
Okay. The work of school-wide positive behavior support has a whole document about how to assess your school to see if it's ready. Are they willing to look at their discipline practices? Are they willing to look at maybe modifying them? Are they willing to go to a data-driven system? It's one thing knowing that you kind of have a problem with discipline in a school site, but are you willing to build in a data system that tells you when the problems occur, where they occur, do they occur more often in certain classrooms than others? Because when you have that data, you're going to modify your program a little bit on an ongoing basis, and it really helps you target where your energy should be. So we provided the tool for the schools to do their own self-assessment of if they're ready. And then we brought them in to do orientation to the model and then to see if they were ready to sign on.
So the program sounds good. Sounds like the schools are ready. So there's always that second or third question. Where does the money come from, especially in these tight budget times? And
it's an excellent question because budget times are very tight. And they're likely to get even tighter in the next few years by all projections.
Yeah.
Fortunately, a number of years ago, some people recognized that mental health services have been cut over the years, over and over again, and really needed some more support, more stable support. So a proposition was put on the ballot a number of years ago. It was the Mental Health Services Act. and the voters passed it. It adds a 1% income tax to people that make $1 million a year or more. So that money, that added funding source, allows us, and the Mental Health Services Act specified that the money needed to be spent in new programs, not just support existing programs. So that was a funding source we had. We thought this would be a good use. We went through a process to decide which programs to use. But that's a funding source we have, and I feel very fortunate that it was available to be used for this purpose.
And how did you go about selecting this program, PBIS? It sounds like it's very well supported. There's lots of evidence behind it, but why that program for Monterey? In rolling out new programs, we really like to involve our partners. Fortunately, Monterey County has excellent partners with a lot of different agencies: education, child protective services, juvenile justice, and other departments. So we partner together very well and look at efforts that we can jointly work on. In this case, we held a number of meetings in the community with our partners and with community members. And we heard from them what type of programs they wanted. Supporting the schools was very consistent. You know, the importance of their mission is critical, and they have major challenges. So if there's a way we can support their efforts, we want to do that. So we heard a lot of input. We looked at different programs through that process, and this is one of the programs we chose to support. And what other factors were used? Community input, it sounds like, was a big one. What other factors were involved?
As Dr. Hauer mentioned, does this have support? Is this research supported? Do we know that it works? You're probably aware of programs that at times sound good, communities get involved with it, they bring it on board, and then they do the research later, and sometimes the research says they're not very effective, or even they are creating more problem than benefit. You see TV shows on Scared Straight. Very, you know, sounds very good. A lot of communities got involved in it. Then they do the research on it, and kids get more arrests after than before the program. Boot camp, that was another program communities talk about. The research doesn't support. The early efforts about their programs, you know, a lot of communities got involved with that. Fortunately for them, my understanding is they used that finding that found that they weren't very successful and modified the program later on, and it became more successful. But we wanted a program that we knew was successful from the start. We wanted a program that had a strong preventative component to it, and these programs that were data-driven. And one question I ask myself is, this is taxpayer dollars we're spending. Is this good use of dollars? Or if I really wanted to look at it myself, if I was paying for this program out of my wallet, would I consider it good value? And in this case, it's clear based on the research, for a very modest amount of dollars, you get a huge payoff on it. So in that ways, it became a very easy decision to make.
And it's already now in 17 schools. Any surprise?
It's in training.
In training,
yeah.
Okay.
You know, and this year it's training and bringing the model in,
Okay.
and then in the following years we expect it to be more fully involved, and then to bring in Tier 2 and Tier 3 activities more into play later on. But you're right.
So in this process that you're going through, have there been any surprises, any things that are unexpected, whether they're positive or negative?
Surprises have been positive, but there's been a few. Dr. Hauer was on. He's been involved in providing training to the county, to both behavioral health staff and educational staff on topics such as autism, behavioral intervention, and things like that. When I asked him, did he know anybody that knew about this school-wide positive behavior support and would be a good trainer if we're able to bring it on board, he lets me know that he travels around the country to provide this training. So to have an expert of his quality right in our own backyard was a very nice surprise. Another surprise is when we brought the program out, we had an idea about a good way to bring it out. We thought, let's bring it out to one school site and let's provide lots of support to it. Let's train them well. Let's pay the schools to pay for substitutes so we can train them and set up everything. And then hopefully they'll do such a great job and get great results that other schools in the same district will want to use the program. And then from there, other districts may see it and say, hey, I want that over here too, and have it ripple effect and spread out across the county that way. So we sent invitations to 25 school districts. We have 25 in Monterey County, and said, this is a program we're looking at. Are you interested? Come and hear more about it, and then we'll decide which school site, we'll select. We're not sure how we'll pick that one, but we want to know who's interested. And we, at one presentation Dr. Hauer was doing, there were 7 school sites there, and they all got very enthusiastic about the program, and they said, rather than only picking one site, what if you just provided the training to all of us, and we'll do all the rest of the support that's needed to bring the program in. And we had our idea, but hey, that sounded good to us too. We approached Dr. Hauer, and he said, well, I'm up for training 17 sites instead of just one. And so that's the model we went with, is we heard what they wanted, we rethought it, and we changed our model in that way. So that was another surprise that we had.
That speaks to the strength of the program, speaks strength of the trainer. That's excellent.
Absolutely, and the enthusiasm the schools had.
And the enthusiasm of the school. Excellent. And sounds like I've gotten a little bit of the answer already to this, but I'll ask it anyway. What is gained by the schools and by the instructors and the community by actively participating in PBIS?
There's a number of them, as pointed out, and so by the students, improved academic performance, they feel safer and more secure in the school setting. For the teachers and the administrative staff, they end up spending a lot less time on discipline problems. So what can they spend more time in? Providing education, providing that academic instruction that the kids need. And administrative staff can support the teachers in that activity and stuff. So that's absolutely critical importance. And for the community and the state, there's a couple of bodies of research that I often think about. The ACE studies that were done in San Diego, and that looked at adults. They did interviews of lots of adults, and they looked at what are health concerns they have and what are social concerns they have. And they also asked them about their experiences in childhood. Did they have any negative experiences in childhood? The ACE study stood for adverse childhood experiences. And that research, there were some surprises in that research. They were surprised at how many people, 2/3 of the people they interviewed, identified an adverse child event that they experienced. Of child abuse, child neglect, drug use in the household, domestic violence, unfortunate things that kids are experienced with. And 2/3 of their population, the children had these experiences. They were also surprised that those events were associated with things later on as adults. Those adults were more likely to have, depression, drinking problems, a whole host of social problems, but also health problems. They're more likely to have heart disease, liver disease. So if there's things that we can do to support kids in school, we know that there's also a body of research about resiliency. Yep. There's lots of kids that are also exposed to those things that lead good lives and healthy lives and are relatively happy and productive. And what's different in their lives that helps them overcome these things often is things like a very strong school environment where they're successful and they can feel good about themselves in school. So if we can support in that effort, everybody pays off. The community pays off, the individual, teachers, everybody.
Well, I'm sold.
Absolutely, I am also.
Now, the principles in PBIS that you've talked about and Dr. Harrower talked about aren't new to you. These are principles that were part of a program that you participated in the past, yes?
Well, a number of years ago, I was a clinician in a school-based program with children that experience severe behavior problems. Back then, we ran the programs, we worked hard, and were fairly successful with these students. And then a while back, the state passed some new regulations and said, you have to deal with serious behavior problems in this different way. Dr. Hauer mentioned a functional assessment. And the reg said, now you have to deal with them by using this model of understanding the function of the problem behavior. Well, initially, we didn't appreciate the state putting more paperwork on us, having to write new reports, new types of assessments. But we used that model, we had to, and implemented it with some students, and we're very pleased with the success we had. So then we started to use that philosophy with all the students in the program, and that model became how we approached all our programs in all 7 programs. And in fact, that body of research that the state used to drive these regulations is the same body of research that's developed later to these school-wide positive behavior support. The concepts are all there. It's about teaching people, the students, the skills they need to be successful before there's problem behaviors. So your energy is about teaching new skills and the skills they need, not on catching problem behaviors and punishing that.
That's the evolution of most of the models these days. In public health, we talked about that during the break in terms of prevention as opposed to intervention.
Absolutely, and it's much more satisfying by the staff doing it to intervene in that manner.
Definitely. Well, thank you, Dr. Smith, for coming. Believe it or not, our time is up. And
Thank you for allowing me the opportunity.
Oh, as I said already, I'm excited to see how this is going to unfold even more so in the years to come in Monterey County. So we're going to take a break right now.